I found out I was sick when I was 16 years old. I used to play football and baseball, but mainly football. And I was just working out all the time, and like I was getting really tired. And like it was funny because it was just like, as much as I work out, I should be like getting more in shape, not falling out of it, And so I went to the doctor, and they was just like, drink more water. And then they were just like, but before we send you on your way, let's take some blood tests, but you can just leave. And they called us like 20 minutes after we left, like, you need to go to MCV. Blood didn't look good, So we came here, and they like within 3 days they had diagnosed me with severe aplastic anemia.
So you think of the marrow as kind of like a garden. When you have aplastic anemia, your garden is bare. You're not making any of the normal cells that you need to have. And the point of the bone marrow transplant is then to put normal cells back in to produce all of those normal white cells, red cells, and platelets again.
If I had to pick a singular piece of advice to give you all, I'd say this: do not let the realities of the past or the possibilities of the future negatively affect the peace, joy, and happiness that the present has to offer.
When I found out I was sick, I was kind of like just in disbelief. I didn't believe it till I turned 19. Like, I was still trying to live my life like I was normal. A couple days before I gave my speech, like, I didn't want to give the speech. I told the people that I was talking to at school about the speech that I was just like, now's not a good time, because I was just finding out like more information about, the relapse and stuff. And I was just, I knew it was in my speech, so I wasn't comfortable giving the speech and saying all that stuff, knowing how, sad I really was. But when the day came, I was happy that I was able to give the speech, because when I was up there giving the speech, I wasn't sad. And I really believed everything I wrote, because certain things I just can't explain. Like, when I was up there giving the speech, it was just like I wasn't sick anymore.
Now, if they don't have a good donor, such as was DeMarco's case in the beginning, then we use what's called immune therapy on them. And so that's a series of different medications that we use to try to suppress the immune system in hopes that the marrow is able to then make normal cells again. Unfortunately, with the immune therapy, there's at least a 30% relapse rate for patients. And so patients that relapse, we then know that we're kind of pushed that we have to try to go to transplant.
There's not a lot of Puerto Rican and black people in the world that are on the bone marrow registry, and I just think it's because like just not a lot of people know. Like, before I got diagnosed, I didn't know anything about bone marrow. I just knew it was the stuff inside your bones. I didn't know you could donate it. I didn't know what it did.
The likelihood of finding an unrelated donor depends a lot on somebody's background. So if you have very common HLA typing, oftentimes people of Western European descent, we can usually find a donor pretty easily for them. But if you have more complex typing where you have more of a mishmash of different backgrounds, it's much harder to find a donor for those people.
Life never stops. And this is just the life that I had to live right now. If you want something, most of the time you got to do something you don't want to do to get it. I want to be healthy. I got to do these things to get healthy. I'm going to just try and listen to everything the doctors say so I can recover as fast as possible. I mean, even though I've been in the hospital for an extremely long time, I still think I'm going to have the fastest recovery ever. Something's going to happen. It's going to be soon. See, I'm having this long hospital stay, so then everything can be really quick afterwards. That's what gets me through the days. But I just want to go just live life.